Living Heart Foundation is a 501c3, a not-for-profit organization that is related to early diagnosis, awareness of the importance of cardiovascular disease, and treatment programs to improve risk factors that are related to cardiovascular disease. Initially, the Living Heart Foundation did studies and testing in high school and college student athletes, and then at a second stage we did screening of rescue workers in New York City after 9/11. Certainly in our starting phase in the early 2003, 2004, the great pharmaceutical company Pfizer was very helpful in providing us with grants that allowed us to get our program started and to build up awareness and momentum about the opportunities with the program. But since that time, the NFL Players Association has stepped up in a big way, and they have provided continuing grants to help us to cover the expenses related to putting on these programs in terms of personnel, equipment, machinery, and all of the things that we do to make this an outstanding program. Corporations at large have also been sponsors and have provided us with funds and support and equipment that have helped us to do the programs. I think the corporations realize that in helping NFL players to live healthier, they in return develop valuable spokespeople that can reach out to the public and increase general awareness about the importance of cardiovascular disease, the importance of regular health testing, the importance of being proactive in evaluating and identifying what the problems are, because that's the first step to treatment and healthy living. I was a player myself, and I identified with the players' needs, especially as they leave the active phase, go into a transition period, and then as they age further into retirement, many of our players have health needs that are not satisfied. So I wanted to help to fill that void, though it was a combination of a genuine interest in the health of the players, because I was one and I knew what they were going through, and number two, to find out what the real health issues were for these players.
Went to college, University of South Carolina. I went to Baltimore Colts for 2 years, then I went to Montreal in the Canadian Football League. I do walk a lot, I play a lot of golf, and I do walk the golf course when I can. But other than that, I quit playing racquetball probably 10, 12 years ago when my legs wouldn't take it anymore. In the last month, I had some problems with heartburn in my chest, tightness and stiffness in my arms and jaw. And I went to Living Heart. They found some irregularities. They had me at the hospital the next day. So we went through an MRI. And really, that's when they recommended a triple bypass. A week and a day after the Living Heart Foundation physical. Well, it's an awakening experience. You know where you come from, and you know that you can go easily. I feel good. I mean, I'm off the pain medicine, which I was on for a long time, and they told me I'd have good times and bad times, which I did. They tell me to walk as much as I can and rest a lot, and don't use my upper body, don't lift anything more than 10 pounds. But I recommend if anybody gets a chance to go through the Living Heart Foundation physical, that they take advantage of it. They tell me the cost of it is like $5,000 to $6,000 if you had it done individually. And what I understand, if you go into an emergency room or a doctor for some type of problem, they're only going to check out that certain problem. And this takes care of a whole scope of a lot of different problems. Cholesterol, high blood pressure, your heart, I guess your brain, I don't know, your ears, eyes, your sleep, anemia. If you have it, they check to see if you have that. But there's a lot of different tests that a normal person wouldn't have done.